Well, it's great to be here with Kathleen and Sumeet. I'm Sonia Singh, the Chief Insights Officer at AVIA. Very excited to talk to both of you about what you're doing at AVA. But let's start with some quick introductions. So, Kathleen, would you like to go first? Tell us a little bit about you, your role. How long have you been doing this?
Sure. Hi, my name is Kathleen Harmon. I'm a registered nurse. I've been a registered nurse for 38 years, 20 years of clinical practice, mostly emergency and trauma services. And then for the past 18 years, I've served as a chief nursing informatics roles on both the professional service side as well as the product side in our industry. So I have a really deep passion for ensuring technology supports leading practice clinical workflows, truly transforming care delivery. And as the Nursing Informatics and Innovation Advisor for AVA, I'm so excited for our conversation this morning. Thank you.
Fantastic. And Sumeet, tell us a little bit about you.
Yeah, thanks, Sonia. So my name is Sumeet Bhatia. I'm the founder and CEO of AVA. And prior to AVA, I was the co-founder and chief technology officer of one of the first clinical communications platforms called Tiger Connect. And we started AVA 7+ years ago with this idea that we could really help nurses, doctors, and patients every single day by providing them with their own personal voice assistant. And I'm really excited to be here today and share an update on where we are in that journey, particularly as it applies to how we can help the largest part of the frontline healthcare workforce, which is nurses, with the new AVA Assistant product.
That's fantastic. And we have had so many conversations with our AVIA Health systems about how we need to find solutions to ease that clinical burden, to address some of the workforce shortage, because that isn't going to, improve itself over the short term or long term, really. So let's start with the core problems. As you started this work at AVA, what are the core problems you're looking to solve? Always start with why. Why are you doing this? What are the problems you're looking to solve? And why are they important now?
Yeah, I'll jump in here. First, I would say that I'm super excited to talk about the current challenges and problems because we are at the place now in our industry that we have the technologies that can support and improve workflows. Really gives us an opportunity to take the problems and challenges we see today and flip those into opportunities. So the first problem that we really address is the administrative burden for nursing as a whole. So this really detracts nurses' time with their patients. It increases burnout and turnover. And actually, time spent in the EHR, the electronic health record, is the biggest culprit here. Studies have shown that the percentage of time nurses spend in the EHR is 25 to 41% for a typical nurse. So this decreases their ability to have those meaningful interactions that they went to nursing school to begin with for. And then to further that, the burden of so many other systems. So they're also interacting with like dietary systems, interpreter services that so many of our patients and families need, policies and procedures, and education systems. So we really do have to unburden nurses to improve their practice satisfaction, recruitment, and retention. And I would say the second problem, which kind of aligns right with that, is that we need to address the documentation compliance. So timely, complete charting is a challenge for nurses because they're pulled in so many different directions. They're trying to manage competing priorities. And oftentimes what happens is that they delay documentation. So they do what we call in nursing batch charting when the clinical situation allows for the time to do that. And we found that it's anywhere from 20 minutes to much greater than an hour from the time that actual information was received from the patient to the time it's documented in the record. So that affects the completeness of documentation, but also from an EHR standpoint, it doesn't have the real-time data to make those clinical decision support decisions. So we find that's the second, probably greatest. And then the third, which is the nearest and dearest to my heart, and I think we're all part of it, is that we've had a history in healthcare of pushing technology out to nurses without really ensuring that it supports nursing workflow and practice. And pushing it out to nurses without alignment to the workflow really compromises adoption and leaves nurses feeling frustrated and unsupportive. I've even seen recently where innovative technology is deployed to, like, say, a physician group, and then the next step is we'll deploy that to nursing, but they didn't do the due diligence to make sure that they looked at the uniqueness of the use cases and the workflow to be able to diversify that platform out to a different group of end users. So it's really important that we do our due diligence to ensure that technology supports workflow, because when it does, then it enables the nurse to practice at the top of his or her license, improving all aspects of care delivery. And one other quick point I should have mentioned in the documentation part is that there's a lot of times that nursing and nursing support teams have to document things that might not feel super critical in the moment to get into the record, something like repositioning a patient. Maybe they think, well, I can chart that a little later. But what happens when we don't have the means to do real-time documentation in an easy way, it gets delayed or oftentimes missed. And in the event of something that seems rather simple, like repositioning a patient, if that patient has a hospital-acquired pressure injury, that could actually cost the health system up to $70,000. So however we can enable people to be able to document the task completed real time helps to ensure that the hospital has what it needs to prove that the right care is being done on the right patient at the right time. So I always say making it easy to do the right thing is a worthwhile investment. So I would say those are our top 3 problems we're looking to solve, and we're able to solve that through the voice enablement and the professional and the personal companion that we're giving to nurses to be able to practice at the top of their license. Anything to add there, Sumeet?
Yeah.
No, I think you did a great job covering it, Kathleen. Thanks.
Yeah, very well said. So what I'm hearing is there's the need for real-time documentation or real-time compliance stuff that needs to be done and documentation, but there's also administrative burden, and the technology solutions that have been sent to nurses so far really haven't been fit for purpose for the nurses themselves, haven't taken into consideration of how they do their work, what is most meaningful for them, and almost like a technology fatigue for nurses as well.
That's right.
So it's awesome that you're thinking about it from truly the nurse's perspective, and even with your own background, Kathleen. So what is AVA's solution to that?
Yeah, and I can jump in, Kathleen, feel free as well. For the past 7 years, to provide a little bit of history, like AVA's been the only voice assistant product or company that's been helping patients and nurses in the inpatient environment, and we've really helped organizations build, and I think we're recently in the AVIA marketplace as part of this. We've really helped organizations build smart hospitals and patient rooms. Using this enterprise managed smart speakers at clients like Cedars-Sinai, Houston Methodist, Baycare, Boston Children's Hospitals, and many others. And we recently started pilots with 2 current clients of ours on that new personal and professional assistant that Kathleen was talking about. It's a mobile application called AVA Assistant. And it's an AI-powered product that enables nurses to not only write to the EHR document in that real time or near time, but also help control all the other systems that Kathleen was mentioning that pull them away from direct patient care. Sorry, go ahead.
Yeah, no, that's fantastic. So how make it real for us? Is that a mobile app the nurse is speaking into to do charting and documentation through voice? Is that how to make sense of it?
Yeah. So I think we've heard the term ambient intelligence now. I think that's the new term of art in the industry, or clinical ambient intelligence. And physicians have had products for quite some time that there was the first generation of products, and now with all of the really exciting activities that are happening with generative AI and large language models, there's the new generation of products that are out there, and they've largely or historically focused on physicians. And so what's really exciting, and those products are similarly mobile applications typically that are deployed to the physician's phones. So with the AVA Assistant product, it's a mobile application that's deployed to the shared devices that nurses are typically given, those smartphones. And and they can use that to chart in real time.
That's great. So maybe Kathleen, you can talk about like how this goes into a nurse's day-to-day or workflow. How would they use this as an example?
Yeah, what I love about it the most is that it's so flexible, so you can utilize it for your own nursing practice. And
Mm,
I believe that we adopt technology more when we can customize it and really use it to empower ourselves. And what I love the most about it too is that you can use it as much or as little as you choose to. So there's a lot of other aspects of the application, such as reminders for yourself. Like I want to make sure that I turn my patient in an hour, or I need to reassess pain medication on this patient in 30 minutes. So it really is empowering for the nurse to actually have a tool in his or her pocket that can be customized to their practice. And I
mm.
think that that really drives that autonomy and that excellence in care delivery. So I love it. I think it's the best thing that ever happened to nursing. So
That's fantastic. It sounds like it was a long time overdue for nurses to have a tool like that. And so in the
yeah.
smart home space, lots of things are emerging. You
Yeah.
know, device standpoint, how does it incorporate or include, or how are you thinking about how it connects with everything else?
Yeah, I think Sonia, thank you for that question. It really is one of Ava's, core strengths. So through partnerships with, some of the amazing health systems organizations that we've worked with over the years, they've really driven the use cases around this type of technology, this virtual assistant, personal assistant type technology. And what they've shared with us is, look, we've made investments into all of these amazing products, right? You were just mentioning there's, in today's world, so there's ambient intelligence products, there's virtual nursing products, there's people are building new hospitals that are smart and connected, similar to folks building new homes. They're making these incredible investments, and then they're also investing in tools like clinical communications and patient experience, some amazing patient experience products. So what Ava, how we like to think of ourselves, and what a big part of what we do is we've connected to now about 50 of these different companies and technologies, and are really creating a voice experience on top of all of that, to really make it easy and allow these organizations to maximize their investment in those technologies.
There'll be like a voice layer that connects a lot of these emerging technologies in their smart.
Exactly. Exactly
Well,
right.
that's great, because I think we have to think about new ways of interacting with technology versus it just being on a screen. I think we're going to see a new era of voice and gesture and all of those things. So you're focusing in on the voice piece, particularly for nurses.
Yeah, exactly right. And yeah, we'll all get to Minority Report at some point. So it'll be voice and hands, and I do a lot
Right.
of hand waving, so that'll be perfect.
That's right. That's right. Um, One of the really important questions is around results, impacts, KPIs that you're looking to move, and what results you've already seen. Can you share some examples around that?
Yeah. So I'll first share an example around our existing product, and then maybe Kathleen can jump in with some of the things we're seeing in the new
Yeah.
with the new Ava Assistant product. So with that ambient smart speaker product, just as one example, at Jefferson Health's McGee Rehab Hospital,
Hmm.
patients were using the device more than 10,000 times a month
Hmm.
to self-serve and lift lower value tasks and room entries off the plates of nurses and other care team members. So these are tasks that include everything from like controlling the lights and
Yeah.
blinds to the temperature and TV, all with their voice. And in many cases, because this is a rehab hospital, these are all of these activities were things that a nurse may have to help you with,
Come into the
a
room and do
therapist, a
that.
caregiver might have to help you with.
Got it. And that's the smart speaker solution that has been you've had for a
That's
while.
yeah, that's that smart speaker or that personal assistant that we've had in market for a while now. That's focused on patients, but also alleviating tasks off of nurses' plates. So, as an example, we have partners where nurses can walk into a room and say, bring up the fall prevention video, and they can
Okay,
the system can turn on the TV and help educate the patient.
that's great. And then Kathleen, you're going to tell us about some of the results from the new solution.
Yeah, so while the assistant application is still being piloted, I can share though that some of our clients, what they're committed to now as far as measurement and some preliminary data we have. So one example is we are looking to measure the time it takes to do some of those heavy volume tasks. So one of those is like a pain reassessment. So every time you administer something for pain for a patient, you then have to reassess to make sure that that was actually effective in their pain relief. So one of the things we're looking at is that's an example of one of those high volume tasks. And today, the manual process where the nurse has to go into the EHR, find the patient, find the flow sheet with the right place to document. When we watch that over time, it's about 3 minutes that process takes. And preliminarily, we're seeing through the AVA voice charting that we're able to decrease that to 33 seconds. So that's like an 80% reduction. And when you look at it over time, and we've modeled this out, looking at a couple of those examples, even though it's preliminary data, we believe it'll be at least an hour per shift. But I think what's even the most important part of it is that empowerment to nursing to be able to use that tool to help their practice and really really ensure that they're delivering the care they want to deliver by making some of those longer activity tasks take a shorter period of time and make it easy to do. The other thing is, patients or nurses are in rooms and they're oftentimes occupied, their hands are. So being able to have that ability then to get help to the room or to pull up something like Sumeet said on a screen, it's really a time-saving measure. So we're going to look at all of that over time. But I think the key thing is ensuring that we're really mapping it to the things that matter most to nursing. So looking at those things first, making sure we get the results from those, and then to continue to build over time.
Well, those are some great examples, Kathleen, and and I know it's early stages, but it sounds like it's already seeing some good results. I'm just curious, how are nurses adopting, learning the technology? Has it been easy? Has it been hard?
Yeah, what's so exciting about that is we use the what I'll call the 1.0 version of these technologies and even the 2.0 now. So if you have a smartphone, you may or may not have tried Siri or Hey Google and or Alexa devices in your home, and so we've all sort of been trained with those types of products. And then if you had an opportunity to play with a product like ChatGPT, you can see where everything is going, where it's so much more conversational. And I think nurses are responding incredibly well because these are technologies they're familiar with, and because the technology is getting so good, it's much easier, and the level of effort in terms of training is really what I'm always amazed because we're able to hand the product, and spend 30 seconds, sort of like a quick navigation, and people get it and they can start to use it right away.
Which is a sign of a great product if it's intuitive and easy to use as well. Well, congratulations on the new launch, and I'll be eager to follow along and how that goes. To wrap up our time here, I know that you have an exciting conference coming up. Do you want to share a little bit about why should people be interested in coming, and we'll send some more information later on how they can sign up.
Yeah. We're a little later in a couple months on October 17th. We're hosting sort of a webinar, and We're really excited that some of our existing partners and health systems are going to share their journey with this new AVA Assistant product and why they're looking to adopt that. And also share some of their past history with us as well. So really hope that people join, and we're looking to engage with people virtually at that event. And you know, we're coming up on conference season, Sonia, here soon in the fall. So we're going to be at, you know, Health and ANCC and next year HIMSS and others. So look forward to meeting people in person as well.
Excellent. And this conference sounds like a great way for other hospital health systems to send folks who want to learn more about the specific use cases and all of that with the new voice assistant product, right?
Yeah, I think if there's you know, folks from a nursing perspective, you know, the folks we deal with on a regular basis and engage with are nursing informatics folks and chief nursing officers and nursing informatics like that, and then of course IT. Those are the folks that we regularly engage with, and so if you're in that audience, I think you'll see some of your peers there, and it'll be great to just you know, have those conversations.
Well, thank you for both of you for your time. Come on to AVIA Marketplace. Aiva has a profile. Learn more about it. You'll see this video. You'll be able to contact the team as well. But thank you both for your time today.
Thank you so much, Sonia.